introduction to IgG allergy testing for foods actually came about a year ago at a basic allergy course given by the AAOA. I was talking to another colleague who said he had stopped needing to do tubes and adenoids and tonsillectomies so often because he was getting food allergy testing, both IgE and IgG. I realized with our hospital it was extremely expensive to get the 10 or 11 foods that were on their basic panel. I wanted 4 or 5, and so when I came to the Pan Am meeting last March and heard Dr. Shaw give a lecture on IgG food allergies, and they told us about their panel of 93 foods for a very reasonable price, I thought, I'm going to try this and see what I come up with in my patients. So starting in March, we began testing many of the patients that had ear infections, tonsil hypertrophy, adenoid problems, and I was overwhelmed with actually the results of how many people were positive to casein, wheat, egg, yeast, and a smattering of other foods. The patients who were willing to go off the foods that were high on IgG began to have dramatic improvements in the symptoms that I was treating them for, but unexpectedly to me, lots of other symptoms. I had patients commonly are improved in their symptoms of GI complaints, constipation, diarrhea. One of the most dramatic patient improvements was a patient that came to me as a referral for a tonsillectomy and adenoidectomy at the age of just 2. He was sleeping poorly, had bad ADD symptoms, and was generally very difficult to manage patient. He came in with his dad, and just watching him just in constant motion in the office, grabbing things, pulling things, moving, hitting, was quite striking to me. His sleep study was pretty significant for some obstructive episodes, but when I checked his tonsils and his adenoids by scoping, he didn't really have large enough tonsils or adenoids to make me feel like a tonsillectomy or adenoidectomy would make any difference in his symptoms. I was thinking maybe IgG was the answer here as far as possibly food allergies causing a nighttime congestion or something of that nature. So I decided to get the IgG test. And when we got the results back, he was high on egg and dairy. And the parents decided to go ahead and try him off those foods. The mom came back with him 2 to 3 weeks later and said she had a different child. And I recently saw her. We got some other testing. The organic acid testing has also helped us kind of hone in on his symptoms. But interestingly, his sleep problems resolved when he was off those foods that he was high on the IgG, and also his ADD symptoms were greatly improved. He's still a very energetic child, probably a little more than your average 2-year-old as far as energy, but mom says the family dynamics have changed so dramatically that she just is overwhelmed. Now, he's had thousands of dollars worth of testing prior to coming to our office. He's had sleep studies and EEGs, and he's seen the neurologist, he's seen the sleep doctor. This pediatrician's been working on this for about 2 years. I was surprised at the results in him, and I was just mainly thinking the nasal congestion would be a little bit better, but I think there was a lot more going on there. They pulled him off his melatonin, and he's medication free now with the results the parents were hoping for with the surgery that he'd been recommended to have. I've had dramatic results with people with chronic fatigue and things of that nature, which I wasn't originally treating them for. But I've realized that the effect of IgG has can go anywhere from the top of your head to the bottom of your toes, and I just happen to be helping them with other pretty significant symptoms when they come in for an ENT complaint and we find these IgG positive allergies. It has pretty much revolutionized my practice over the last 8 months. As far as Great Plains goes, we love them. They're great to work with, very personable, get back to you quickly, and are pretty much willing to help us in any matter, come up with new test batteries that we think would be helpful for our patients. They work with us on pricing and patient insurance issues, and we've been